A 23 years old lady undergoes a total thyroidectomy as a treatment of the papillary carcinoma of the thyroid. The pathologist examined histological section of the thyroid gland and identified this Psamma body. So, what is the primary composition of this Psamma body? That means what is the content or what is the composition of the Psamma body? Here the options are the cluster of calcification, aggregation of the neutrophil, aggregation of the macrophage, giant cells surrounding the tumor, and cluster of the oxalate crystals. So first of all, let's see the Psamma body. What is the Psamma bodies? The Psamma body, actually it is the cluster of the microcalcification. That means it is a chain of microcalcification, or it is a circular pattern of the microcalcification present in the tumor cells, and they are mostly commonly seen in the papillary carcinoma. So the Psamma body, it is the characteristics for the papillary carcinoma. So papillary type of the carcinoma of the thyroid gland, there is cluster of the microcalcification, and this microcalcification is known as the Psamma body. Here we can see this is the Psamma body. Here the Psamma body, that means the cluster of the microcalcification around a tumor. Here we can see this is the circular pattern. Here we can see this is the circular pattern of calcium deposition here. So these are the Psamma bodies. So the Psamma bodies, it is the circular pattern of the calcium deposition in the papillary thyroid cancer, and this Psamma body also present in different conditions, such as here we can see this is a P for papillary thyroid carcinoma, another P for the papillary cancer of the endometrium, then serous cyst adenoma of the ovary, meningioma, mesothelioma, and adenocarcinoma of the lungs. So in this condition also there is a chance of development of the Psamma bodies. So again, the P for papillary thyroid cancer, papillary carcinoma of the endometrium, serous cyst adenoma of the ovary, meningioma, mesothelioma, and adenocarcinoma of the lungs. And among them, two are the most important. One of them is the meningioma, and the most important is the papillary thyroid cancer. Because in case of the capillary thyroid cancer, there is Psamma body. Also, in case of meningioma, there is the Psamma body developed. So here we can see the Psamma body. So what is the Psamma? The Psamma means the Greek for sand. So the sand web, here we can see the web of the sand. So this pattern, the calcium deposition occurs here. This picture is not so obvious, but we have to or we can gather information from it. It is the concentric. Here we can see this is the concentric lamellated deposit of the dystrophic calcification, and so it is the concentric pattern present in case of the Psamma bodies. And let's see about the papillary thyroid cancer, and this is the most important slide for the papillary thyroid cancer. In the question, actually the information present within this slide, and here we can see this is the papillary thyroid cancer. It is the mixture of the papillary cell, and also there is mixture of the colloidal field follicle. So two important parameter, one is the colloidal, another one is the papillary. So papillary and colloidal field follicle, they are the papillary thyroid cancer. And histologically there is the papillary projection or finger-like projection usually present. Seldom encapsulated, that means they are non-capsulated. So papillary thyroid carcinoma, they are non-capsulated, and usually lymph node metastasis develop. And here is the mnemonic is the LP, which is the lumbar puncture. Here it for the mnemonics only. So lumbar puncture. So in lumbar puncture there is the LP, that means the lymphatic papillary carcinoma. So papillary carcinoma, it is the lymphatic, or PL, or prolapse lumbar discs, PL. P for papillary and L for lymphatics. So it is the mnemonic, and we have to remember very carefully, because in the different type of the question, in papillary carcinoma scenario, there is scenario of the lymphatic metastasis, and only this point it is enough to answer the question. And it is the hematogenous metastasis is rare, actually not occurs, and it accounts for 60% of the thyroid cancer. That means most of the thyroid cancer. And that means the 60% of the thyroid cancer, they are the papillary carcinoma. On the other hand, the other carcinoma, such as the follicular carcinoma, they accounts for only 20%. So now what is the Psamma body? Psamma body is nothing but the cluster of the calcification. So the cluster of the calcification, it is known as the Psamma bodies.